Hello everyone. This is a typical examination that we would do on one of our patients here at Bakerstown Animal Hospital. And although we're demonstrating on good old Mama Kitty here, we would do the same basic front to back examination on a dog. So we do it kind of front to back, so there's a system to it. And as I do the exams, I'm often talking to the owner as well, explaining what I'm seeing or what I'm doing. And so I usually will start by even just looking at the animal before I'll get my hands on them. I see her every day, so I know that she looks pretty good. But oftentimes I'll get the history from the owner, and as I'm listening, I'm also just looking at the patient and just kind of getting a feel for things even before I get my hands on them. But typically I'll start with the ears, and again say to the owner as I'm examining the ears that they look normal, or if there's a problem sometimes I'll mention that, but go on with the exam and say we'll come back and deal with them later. Because I don't want to get hung up on one thing, tunnel vision, and then miss the rest of the exam. Typically on an eye exam I would turn the lights out, but for the purposes of the video here I will not. And I'm often saying to the owner the structures that I'm seeing in the eye, the retina, the lens, the optic nerve, mentioning other eye structures that people are very frequently familiar with. So I've checked one eye, I'll check the other eye, and again always hoping that things are going to be normal, and I'll tell the owner normal, or if there's a problem I may not mention it, but I'll come back later and talk about it. Teeth and dental health are very important, and most of the time our patients are very good about allowing us to see in the mouth. And sometimes if there is mouth pain from tooth or gum disease, then we won't get a real good view, but we can get a sense of pain and discomfort, and then we can talk later about some things that need to be done. We work the joints over, and again as I'm talking with the owner, I'm mentioning what joints I'm feeling: shoulder, elbow, wrist, because again people know that those are the joints on the human side, same thing on the dog and cat side. So I've checked her over up front, worked the joints over. At the same time I'm also checking for lymph nodes. They can be in various parts of the body. Normal lymph nodes are ones you don't feel, and so Miss Mama here, all of her nodes feel good. I'm out kind of in the middle section here. I'm just checking her tummy out, make sure abdominal organs are the right size and right location. Always run my hand through the tail. Sometimes there'll be a kink in the tail or from an old injury or maybe even a tumor, so I'm always checking that. And then as we work the back legs over, hip, knee, ankle, both sides, I'm also looking at the bottoms of the feet just to make sure they haven't stepped in something caustic or something irritating to the feet, or if they're feet licking or foot licking, I can tell just by the way the feet look. So her tummy feels good, and frequently I'll mix up either feeling the tummy and then I'll listen first, or I'll listen to the heart and lungs and then do the belly. So I'm just listening for an abnormal heartbeat or a murmur. Want to make sure the rate and rhythm are good, and I want to make sure the lungs are clear. Now oftentimes I'll wait till I'm done with the exam listening because people will talk to me sometimes while I'm listening and I can't hear what they're saying. But again, I tell them what I'm listening for and if we have a problem or not. And always looking at the back side, looking at the skin, looking underneath at the skin and the hair coat, and I have got my hands on the patient all the time, just kind of feeling for lumps and bumps all over, getting the quality of the hair coat. And every animal, every patient gets a flea check. No matter what the time of year, this is my flea comb, and I'm just making sure that there are no fleas, and there better not be in a hospital cat. So, negative, no fleas. They're easiest to find back in here. They can also be found up around the collar easily, but this is a great area for me to check. So in a short period of time, I've been very thorough in examining this cat from one end to the other and talking with the owner about what I'm finding or seeing. And again, frequently if I find a problem, I'll wait till the end because I don't want them to get upset or hung up with one problem and then maybe we miss other problems, or they're upset about a problem. I want them to hear all the good things that we found too. So this is a pretty typical examination on either well visits or even sick visits here at the hospital, because we don't want to miss one problem while we're focusing in on another, and then tunnel vision prevents us from taking care of all the problems. So that's our typical exam at Bakerstown Animal Hospital, and we thank our hospital cat.